MelloMallows, and if folks could quiet down so we could listen to her give her pitch.
Hello everybody, thank you so much for coming here tonight to hear our pitches. Thank you so much to Michelle and the whole Ignite team. This has been such an amazing experience and I couldn't be more thankful, so thank you so much. My name is Dr. Tesia. I'm an OBGYN and the founder of Fruits of Labor Inc. Actually, for our first device, we worked with Nova called Peri Peach, a device to help prevent severe tearing. And so we're so excited to continue to work with Nova and the Ignite team with our next device called MelloMallows, where we're trying to make gynecologic procedures less painful. So this here is a tenaculum. It's a two-pronged device that we use for almost every single gynecologic procedure that we do. You clamp it onto the cervix and pull on it in order to do any procedures such as IUD insertions, biopsies, fertility evaluations. And this device is actually really good for OBGYNs. It takes up minimal space in the vagina while providing really high-quality counter traction on the cervix. But unfortunately, this step of injecting lidocaine prior to clamping down on the cervix with a tenaculum is often skipped due to increased use of resources, time, and honestly, just the culture of GYN. When I went to go get my second IUD placed earlier this year, I asked my OBGYN for lidocaine and was initially denied. But I'm glad that they finally gave in because during my insertion, I could feel that this tenaculum had pulled through my cervix twice. And when we think about the origins of gynecology, it was literally built on enslaved women where pain was completely disregarded. And we still see this today with patients sharing their experience on social media and over 90% of women reporting pain with the tenaculum. And great, our professional organizations have responded, changing our guidelines, urging OBGYNs to take pain more seriously. And new innovations have emerged. But unfortunately, to tell hospitals to replace a device that's practically free that all OBGYNs use and love with a single-use costly device is a really difficult sell. So for all of these reasons, pain with gynecologic procedures remains undertreated today. And that's why I created MelloMallows, these simple dissolvable lidocaine puffs that attach to the ends of the tenaculum with just one click. When it makes contact with the cervix, it melts just like a Listerine breath strip, coating the cervix with lidocaine immediately right before placing this tenaculum device. Hospitals get to use their basically free device, doctors get to continue to use this device that we know and love, and patients get the adequate pain control that they so deserve. And compared to our competitors, MelloMallows addresses all the pain points at a lower cost and is more efficient than the standard of care. We have our IP tightly protected, and with our regulatory pathway, lidocaine on mucosal surfaces is already very well studied, so we're able to skip a lot of these phase 1 trials. In addition, not included on the slide, but we have closely and tightly protected our loading tray, which will be a medical device accessory undergoing the 510K pathway. And our materials are very cheap and very readily available, meaning our cost of goods are very low and our margins really high. We'll first target the endometrial biopsies, over millions of endometrial biopsies done in the US today, and we can quickly grow given that the tenaculum is literally used for almost every gynecologic procedure worldwide. We estimate over 88 million procedures done globally every year. Our competitors actually quote over 120 million. And given our high margins, we anticipate high profits very early on. We'll first start selling to OBGYN, traditional OBGYN clinics where a CPT code already exists, as well as IVF clinics where patient satisfaction is a top priority and more flexible payment models already exist. This past year, we focused on protecting our IP, developing our prototype, and once again, we're so thankful to the Nova Ignite program to help MelloMallows build the strong foundation that we continue to grow on. Next year, we're excited to find our development partner, continue to grow, and perform our first clinical study. This is our team. I myself am the founder. My father is our CEO and president of my company, and we have our legal team as well. And we're currently looking for a pharmaceutical partner. Because the impact that we want to have is to save money for hospitals, give clinicians an easier tool to provide anesthetic for their patients, and most importantly, end this unnecessary pain with gynecologic procedures for patients. Thank you so much.
2 minutes for questions.
Hi Tess, great job, thank you. My question is around, as a clinician, can you talk to the time that this might take that's different from standard of care?
Yeah, I can actually even demonstrate it here. And also even show it to you listed here. So the current standard of care involves a needle, and whenever you have medications that you're drawing up, it requires a nurse, it requires multiple needle transfers, a lot of materials, and also all of these things go into the sharps disposal, which has additional costs. For MelloMallows, all you have to do, here is our loading tray and our MelloMallows. All you do, peel off the outer part, open your tenaculum, click, you're done. And then you just place it on cervix, it dissolves, nothing to clean up, no risk of retained items in the vagina.
Thank you.
Very cool.
I do have a question about insertion. How can you assure that they stay attached to the tenaculum and don't go somewhere else that they're not supposed to go?
Yeah, so that's a great question. So initially we were considering doing a combo device with these kind of clips on it, but then we realized, let's make it even simpler. Well, we can make this drug formulation like a marshmallow formation, so it can just stick on there by itself, and then you don't have to worry about these things, removing them or them being left inside the patient, and it also makes the regulatory pathway easier.
I really enjoyed your presentation. It seems like you're addressing a really important problem, both on the clinical side as a practicing clinician and also apparently as a patient, because you were denied what currently exists. Can you talk through a little bit more, or maybe expound on how you see this being adopted? It sounds like it's great that there's no needles, there's no sharps disposal, so it's a lot more feasible to be used, but what roadblocks, if any, or maybe not, what excellent reception do you anticipate?
Yeah, so I'd say these new guidelines came out with ACOG this summer, so clinics are working to kind of fulfill and provide more pain for gynecologic procedures. Also, I've been talking with IVF clinics, and their response has been really excited. They're like, our nurses really want this. Anything to make the whole IVF procedure a little bit less painful for patients is very, very highly sought after.
Thank you. Kim, marshmallows, congratulations, $750. Well, thank you everyone. Thank you again for attending.